The pandemic has taken a significant toll on oral health. Their dental practices have been open for preventive and other care for months. Many patients still haven't returned for routine treatment, making simple oral issues much worse. Meanwhile, the stress that patients have been feeling is manifesting in clenched jaws, grinding teeth, and dental injuries as well. How can dentists address these issues? Dr. Adam Marina, an Aspen Dental practice owner in Lawrence, Kansas, may have some answers. Dr. Marina, thanks for joining us today.
Thanks for having me, Richard.
Okay, great. Well, let's just start at the beginning. Have your patients been delaying or skipping their routine treatment during the pandemic?
Yeah, it's getting a little bit better now that I think that the vaccines are coming out. But before, whenever it was kind of the height of the pandemic, even though we were open, there was quite a few people that just kind of they just didn't, they didn't want to put themselves at risk by going into a dental office, even though we were taking precautions.
And once these patients finally did come into the office, what kinds of effects did you see on their oral health?
Definitely the teeth clenching and the grinding. It was a big issue. We actually had one patient that said that he had coronavirus and he had broken some of his teeth because he had a seizure. So I mean, it was anything from just minor stress issues from kind of having to deal with the pandemic to all the way up to actually people having symptoms from COVID that was leading to some of these breaking of teeth and bruxism.
Were there any other significant or interesting or unique cases that you saw as a result of the delays in the pandemic?
Mainly just a lot of people that just hadn't been in so long that their treatment, which was, 6 months ago was kind of minor, had just kind of progressed to where it was much more serious now.
Okay, and what kind of strategies did you employ to get these people back into the office? Were they just simply calling you saying, I'm finally in pain, I need to come in? Or did you use other kinds of strategies as well?
There was definitely people that were coming in for those reasons. However, a lot of it kind of came down to us reaching out to our township here and telling people that we're staying open. We're here for you through the pandemic. We're taking extra precautions as far as sterilization and sanitization to make sure that you're safe. We removed all the magazines, any kind of shared equipment or anything that was in the lobbies. We are seating people in separate areas. We're staggering appointments. We're moving to a less like personal check-in experience. So these
Mhm.
people are just kind of checking in on the iPads, and they're able to do that on their own, so that they don't have to interact even with our staff as much. So we can limit contact as much as possible.
And how about getting that message out to the people in your area? Was it via email, social media, phone calls? What strategies did you specifically use?
So I actually reached out to the Chamber of Commerce because we actually have a very active Chamber of Commerce here in Lawrence, Kansas. And I
Mhm.
reached out to them and I just told them, hey, if you could just kind of send like an email blast to everyone that is, a member of the chamber or anyone who gets just the updates from it, and they can kind of let their, friends, family, and employees know that, we're staying open, because there was quite a few dental offices here in Lawrence, Kansas that stayed closed throughout the pandemic. And there was a lot of people that didn't think that any of the offices were open because they'd call up but their office wasn't there, so they didn't know where to reach out to. So we did that, as well as some online advertising, just basically saying that we're here for you when you need us.
So that kind of community collaboration was really important to getting the people back into the seats.
Hugely important.
Okay, and of course, once they did come back into the office, you did say that you were making a lot of the changes we've already heard about, staggering the seating, staggering the appointments, calling people from their cars to come in, removing the
Yeah.
books and magazines. But once people got into the office, how did you put their minds at ease and say, okay, everything's going to be safe. You don't have to worry about infection, transmission, and that sort of thing?
I mean, we made it. We actually have signs on every one of the doors that basically says that this room has been sterilized and by who. That way, we can hold everyone accountable for it. And I mean, we're making the patients see, as we're bringing them in, that everyone is wearing masks. We've had a couple issues where patients come in and they say, I don't wear masks, and we have to ask them to leave. But
Mhm.
we have all our staff's wearing N95s. We're sterilizing the room before they get there, even while they're in there. Just making sure that they even see that we're going the extra mile to keep the equipment and them clean.
Did that happen often where patients showed some kind of resistance to the infection control protocols you were putting in place?
I wouldn't say often, but I'd say a handful of times, enough that there was times that we basically had to say, if you don't comply with the rules, then you'll have to be asked to leave, or we'll have to be, take more drastic measures.
Okay, and hopefully you never actually did have to get to those drastic
No,
measures.
no. Thankfully,
Okay,
no.
well, that's good to hear. But also, were there any other techniques that you used to address their stress in terms of not just showing them the infection control procedures, but other communication tools out there, like auxiliary materials, like guidelines, videos, posters, anything like that?
Yeah, so every room, as well as the hallways and in the lobby, we have everything posted saying the precautions that we're taking, the requests that we have of the patients, as well as us, taking their temperatures and taking recording basically where they've been, if they had any contact with any other patients that may have had COVID-19, and any locations that they may have been out of the country or out of the state.
Okay, and also, dentists themselves and dental staffs, they're not immune to any of this stress and worry either. How have you and your team been coping with all of these changes?
It's definitely been a weird year because normally, that like one of my favorite things to do is to kind of hang out with my friends, go out to nice dinners, and just kind of be around people. And so it's been a lot on myself as well as my office. So I've learned to cook a lot better than I used to.
Mhm.
I've been, practicing a lot of recipes at home with me and my wife. We've been using like HelloFresh and those like delivery services that deliver like all the stuff to you, as well as going on hikes. We have so many awesome lakes around here that there's really no one at, so you can kind of be on your own and enjoy the outdoors. That's helped a lot.
Okay, and how about inside the office? How do you bring the stress level down once you're at work and in practice?
Honestly, it's just been kind of just keeping a lighthearted attitude about everything. Me and my staff, we have a really good rapport with each other. We spend a lot of time, talking about, work and things like that, but we always take time to kind of let loose as well as, take breaks. And it's been a little bit nicer that we've been staggering schedules a little bit because we have some more time in between patients to, kind of talk things through and, enjoy each other's company.
Okay, and so has this approach extended to like the morning huddle and other what would have been routine procedures before the pandemic?
What do you mean?
Well, just when you meet with your staff, when you meet with your auxiliaries, um, has it been a challenge really to keep their morale upbeat and focused during the whole time?
Oh yeah, yeah, absolutely. I mean, I think this pandemic's kind of affected everyone fairly equally. I think. I mean, some maybe a little bit more than others, but everyone's definitely felt the effects of it. And so in the morning huddle, we talk about our patients for the day. We go over how can we make the day better for them, and what ways we can kind of go above and beyond to make them happy. And
Mhm.
my staff really that's kind of their goal, and that's what improves their attitude as well. So every morning we go over that. We talk about yes stories, basically like how we got someone to say, like that, that they came in, they were, having trouble maybe financing a treatment or getting something done, but that we figured out a way of getting them that denture or getting them that, that new smile that they've been trying to get, even if it was difficult for them.
So sharing those success stories of treatment acceptance, that's been a big part of keeping the morale up.
Yeah, huge.
Okay, and also as part of Aspen Dental, what kind of support has the company given to you, your practice, and your team?
Aspen has been phenomenal. I mean, even from basic things, just in getting supplies and sanitation equipment. I mean, they've been instrumental in making sure that we keep the office safe, as well as my regional managers, my district managers, helping to just keep the keep the staff motivated, keep our patients able to schedule appointments and making it safe for them as well. I mean, whenever the pandemic kind of shut everything down and they only kept a few offices open, we were able to create a streamlined process so that when patients walked in the door, they were able to minimize social contact as well as well as still get the same treatment and same care that they were getting before. We've also incorporated a lot of teledentistry, which to me before I never thought that that was ever going to be a thing because how do you look at teeth through a phone? I mean, even with the FaceTime and Zoom and things that we have now, even how good that is, it's still difficult. So Aspen has found a way that they actually, I think in like it was like 8 days, we actually had from having zero teledentistry to having a full force at every office that was open.
Okay, and have you been able to keep up with all of the technology changes as well, like things like teledentistry and maybe some of the other tools that you might need to accomplish all this infection control, these new infection control protocols? Have you been able to incorporate those technologies too?
Yeah, absolutely. I mean, it was a little slow going at first, but having the support of Aspen and my regional manager and my office manager has been amazingly easier now.
Okay, was there a continuing education element, because getting brought up to speed on what the CDC was saying, what the ADA was saying, what all the different health organizations were putting forth as far as what the new infection protocols were going to be? Did they help you keep you informed on all of those changes?
Absolutely, yeah. I mean, I mean, it was actually surprising how fast they came out with the CEs and educational component to it, because it seems like that has to go through so many channels and basically be written up and then recorded, presented to multiple people before it gets approved. And it was within, I'd say, maybe a week to 2 weeks that they had something for us, that they were showing us how to streamline the treatment, how to streamline the check-in, how to make sure that everyone was safe, and how to use the teledentistry for consults.
Okay, and hopefully with the vaccines now being rolled out, we might get back to normal, whatever that might mean, sooner
Hopefully,
rather than later.
yeah.
Exactly. But of all the changes over the past year, do you see any of them becoming permanent? Something that's going to continue once the virus is beaten?
Yeah, so I mean, there like the things like teledentistry. I never thought that that was anything that was going to be permanent before. I mean, I would have said like maybe in a few exceptional cases that would have been something that I guess he had a few offices or like rural communities. But now I think that's going to be part of just our day to day. Another thing, the like virtual check-ins, the being able to use the kind of the hands-off approach or doing it from your phone, and just keeping things safe and contactless is going to be something that's never going to go away at this point. I think, I mean, even with the vaccine, I'd be surprised to see just going back to normal without wearing a mask is going to be funny.
Hmm. And so, with all these changes that have been implemented, and if they continue into the future, have you had positive feedback from the patients? Have they come to you and said, this is great, I feel more comfortable? What have you been hearing from the patients themselves?
I've heard, I mean, yeah, they definitely say that they're more comfortable. I've heard a few people that, that don't fully understand the experience because some of the elderly population or people who just have difficulty using some of the electronics or the new systems that we're developing. But I think Aspen has made it so easy to use that even people who have difficulty with it, they're okay with it now.
Okay, and looking at all these different changes, what advice do you have to other dentists, other dental practices on what's worked for you? What hasn't worked for you? What do you think will improve care overall going into the future?
I think that the main things that work for us is just making our patients feel safe using those, the things I was talking about, the teledentistry, the streamlined access to check-ins and contactless experiences. Those things I think were very helpful. The things that I think that were difficult were mainly just finding someone to help you get supplies. I think that having a big company like Aspen Dental was instrumental in getting those supplies to us when we needed them, especially when there's such a shortage everywhere else. So, I mean, my advice would be just, keep staying safe, try to stock up on supplies when you are able to, and, keep your patients safe as much as you can by not giving up on these procedures too soon. I think that some people might get comfortable, whenever we say like, oh, we're at 70% or 80% vaccine rate, does that mean that we can stop doing these things? And I don't think it does. I think that we need to let this go on a little bit longer and make sure that we keep up these standards of care so that the patients are safe longer in the future.
Okay, and do you have any other comments about how the pandemic has changed the way you practice or how it's changed dentistry overall and looking ahead into the future?
Um, I mean, I think it's kind of just changed our whole life in general. I mean, I don't know if it's just dentistry or everything, but I think that just going into the future, I mean, we just need to make sure that we take these precautions that we weren't before. I mean, just going out right now, I mean, without wearing a mask, if I walk outside and I don't have it on, I feel kind of weird. I mean, even when I come home, I like it feels weird to even have to take it off at this point. So I think just some of those changes going in the future are just going to be our new normal.
Okay. Well, thank you for sharing your perspective and insights with us today. And good luck as you and your practice roll out into the future then.
Thanks so much, Richard.
Great. Thanks. Have a great day.
You too.